A busy day in one of Damascus' public hospitals. Staffing is at full strength here, but there is a medicine problem. Pharmaceutical supplies were one of Syria's success stories. It used to produce 90% of its own needs, but the violence has hit this sector too.
We have some decrease in some kinds of drugs. We have about 20 kinds of drugs unavailable here.
The situation here is relatively lucky. There are some shortages in this government-supported hospital, but across the country, the situation is far worse. Dozens of hospitals have had to close down. And it's not just hospitals. The fighting in the north of the country, in the city of Aleppo, is where the majority of pharmaceutical factories were.
It's reaching a point of crisis. I think it has been really struggling for 2 years now, since the beginning of the crisis, to stay alive and to keep going despite very difficult conditions with sanctions, which has really affected the pharmaceutical industry.
How much of it is still operating or producing?
Now, 25–30% at maximum, I would say.
For now, shelves of pharmacies in Damascus are still full, but the chemist says they are beginning to feel the strain.
The medicine situation isn't as it was because of what's happening in the country. There's no fuel, factories are closing down, workers can't get to work. We're getting some shipments, but not as it used to be, and definitely not according to the needs.
The government recognizes there's a problem and is reaching out for help.
They have turned to WHO and asked for assistance. We are talking about essential medicines here, which are life-saving. And we are actually then trying to see how we can supply this, but we are also appealing to the humanitarian community for funding for this to make sure that we can get the medicine in.
The UN says they are supplying opposition areas too. These makeshift hospitals are the most in need. They are in hotspot opposition areas and attacked by government forces. Medical staff here are the most at risk, and it's dangerous to get supplies in. Lina Sinjab, BBC News, Damascus.